Hi, and welcome to Fairview Range Focus. I'm Deb Boardman, the President and CEO at Fairview Range here in Hibbing. Normally what we're taping this time of day is our monthly segment on healthcare topics, but today we're bringing you a special edition about depression, especially during the holiday season. Today I'm glad to welcome with us April Swartz, who is a family psychiatric nurse practitioner here at Range. And she's going to be discussing things like stress and depression and how you deal with those, how you diagnose them, and what resources are available for people in our community. So, welcome, April. Glad you're here today.
Thank you.
I think many times people confuse and don't understand the difference between stress and depression. Is there a difference?
There is a difference between stress and depression. Stress is more of an acute situation. We all have stress in our lives and we all respond differently to the stress. Depression is more long-standing, and stress doesn't always cause depression when it's acute and short-lived, but when stress is over a longer period of time, it could definitely contribute and cause depression. Holiday stress is more of an acute setting, so it typically doesn't cause depression, but it can contribute to worsening depression of people who already have a diagnosis of depression or that are already suffering from depression.
So when you say an acute, that means time limited, short term?
Yes.
Okay. So talk a little bit about what depression actually is.
Okay. There's specific criteria in order to be diagnosed with depression. There's about, I think, 9 criteria in a diagnostic statistical manual that you need to have at least 5 of the criteria, which they're all symptoms, in order to be diagnosed with a major depressive episode. The criteria, if I can remember all 9 of them, include feeling depressed or down for most of the day, and all of these symptoms have to be present for at least a 2-week period of time. So feeling depressed and down most of the day, lack of enjoyment in your typical activities, excessive sleepiness or inability to sleep. I more so see inability to sleep well instead of the hypersomnia. A 5% weight change without diet or exercise, and it's usually weight loss, but there can also be atypical when people gain more weight with depression, such as seasonal components. People tend to eat more carbohydrates. And
Comfort food.
Comfort food. Macaroni and cheese and mashed potatoes.
Right.
And then there is chronic guilt, excessive guilt. And that guilt can often have a delusional component to it, where people are having inappropriate guilt of things they may have never done, feeling guilty about things they've never done or that may never have happened. So that's one of the symptoms. Also, chronic or suicidality, having any suicidal thoughts with or without a plan. I think I'm on 5 now.
Okay. Well, when you talk about that, is the person who has true depression, are they able to determine that for themselves, to figure out the things that you're just talking about, that's really happening?
A lot of people know, but there are some people who do go in and seek help, stating, you know, this is how I'm feeling, I feel different than usual, and they tell their provider that they're having those symptoms. But there's a lot of people that don't, because sometimes people don't fit all of that criteria perfectly. A lot of people think depression equals tearfulness, sadness, which is not always the case. A lot of people are very irritable and angry, and I think that that's often overlooked as a symptom of depression.
So I think one of the key things you just said is that if you feel that you're not yourself, there's something different.
Yep.
Whether it's, as you say, crying, whether it's irritability, there might be many different ways that it shows itself.
Absolutely.
Let's go back and talk about stress for a minute. Obviously, this time of the year during the holidays, you hear a lot about stress. What kinds of things cause stress? What do people do that add that to their lives at holiday time?
Around the holiday season, there's a lot of grief. We've all experienced grief around the holiday times, I'm sure, with a loss of a family member due to death or somebody that's not able to be with us during the holiday season. And a lot of people grieve differently. People with depression typically have a harder time with stress and grief. So we need to have good coping skills in order to deal with our grief. There's also family turmoil. Not everybody in the families get along. We see the Hallmark commercials where everybody gets along, everybody's smiling, tears of happiness and joy and wonderful gifts. It's not like that in every family. There are family members that don't get along and that they have to be under the same household for the holidays. And it's difficult for them. And it's not just difficult for the two of them or the three of them, it's difficult for the entire family. So it affects the entire family. And then financial problems are one of the other bigger ones that I see. And not everybody can afford to get the gifts they want to get their loved ones. And they feel guilt about that, or they have a hard time.
All that adds up.
And that does add up.
Having worked in hospitals my entire life, which are predominantly female, one of the things I've noticed over the holidays is that there's a lot of stress because you have typically young moms who are trying to juggle school programs and parties and work and shopping and preparing for Christmas, and there's just so much more on their plate than there has been over the rest of the year.
Absolutely.
It's a difficult time.
Prioritizing and organizing and list making is really important during the holiday season, so you don't forget things, so you don't get too overwhelmed. It helps a lot.
You mentioned a little bit earlier about specifically to grief, but just with handling stress, what other tips do you have for people about how to best have coping skills to deal with stress?
Well, stress around the holidays, you can deal with it by list making, budgeting, financial budgeting. What are your priorities, and who do you need to buy for the holidays? Maybe you could bake something for instead of purchasing something for them to, extend your budget a little bit more. Also, some people have poor coping skills. Some people increase their alcohol intake or drug use or cigarettes, and some people have better coping skills like exercising or reaching out to other people and discussing their stress. And it's important to stay open with your family and with your friends or your therapist to get the stress out there so you don't feel like you're alone.
Yeah, I can tell you from my standpoint as being a grandma, the greatest gift people can give me is time with my grandkids. So it doesn't have to be a monetary gift. Sometimes it's just the things of a family picture or having time to spend with my granddaughters. That's almost the best gift I can get. So
that's absolutely true.
Let's talk a little bit for a minute about if someone now feels that they're not the same as they have been before. How do they go about getting diagnosed with a depression diagnosis?
Okay. I think it's hard for people to talk to their providers about their symptoms because they feel like, well, I can just pick myself up by my bootstraps. And that's a common misconception. And they feel almost bad about feeling the way they feel. But people need to be talking to their providers or their family about any of these symptoms that I discussed earlier with lack of energy, low motivation, irritability, anger, sleeping too much or too little, and especially suicidal thoughts.
It's been my experience that I hear people talk about this all the time, that people go to their physician or to their practitioner and they're embarrassed to tell them whether it's medical or this type of a diagnosis or something they're concerned about, but that's what you're there for, right?
Absolutely. There is a stigma to most mental illness, most diagnoses for mental health, and that's what makes it hard for people. But I think that is decreasing significantly, that stigma.
Certainly. Sometimes when there's negative thinking in depression, and it seems to me like it's kind of a circular thing. You feel like a lost cause and that there's nothing that can be done. So what do we do for depression? What treatments are available?
Depending on your symptoms of depression, there are so many options. The number one treatment is therapy and medication management, but many people can do therapy alone. But there are some people who do therapy and medication. And depending on the symptoms of depression, medications might not be needed, or there's multiple different medications. There's the most common is probably serotonin reuptake inhibitors. We all have heard of probably Prozac, Zoloft, Paxil, selects Lexapro and Luvox, and those are the most common. Their side effects are quite minimal, and if you do have side effects, the nice thing is you can stop the medication, the side effects go away, and then you look for a different medication that will help you. But always medication and therapy combined is what literature supports. It's the best option.
You know, again, I think people have a preconceived idea of what therapy looks like. It's laying on the psychiatrist's couch. What does therapy for depression look like? What actually happens?
Well, really, it's a lot of people with depression or anxiety think they need to retrain their brain on how to think, and it's not laying on a couch. It's not, you know, hypnosis. Typically, it can be, but it's often just speaking with somebody, you know, with a lot of knowledge, and somebody that you're comfortable with. Finding a therapist is like shopping. You can't stick with the first one if you're not comfortable with them. So, you know, they're not offended. You can, you know, move on to somebody else if you don't feel that connection with them and the ability to feel comfortable with them or talk to them. But it's really just retraining your brain and how to think and doing homework. Therapy doesn't end when your session ends. You have to do stuff at home when you get home.
You bring up a good point that you have to find someone, a therapist, that you can really connect with and trust.
That's accurate.
Can you tell us a little bit about the background of someone who can provide that kind of therapy? What have they been specially trained in?
Oh, there's so many there's different types of therapists. There's licensed independent clinical social workers that do a great job. There's PhD psychologists. There's, I think there's some nurse practitioners that do therapy as well. And typically it's psychologists and licensed independent clinical social workers. And they have years of experience with, in school with different treatment options. There's different treatments, cognitive behavioral therapy, dialectical behavioral therapy. There's different therapy options that they've all been trained in, and they find the one that fits you.
So they're able to talk with you individually and tailor the therapy to your needs.
Absolutely.
So what does it typically look like? You come into an office setting, sit down at a table, typically talk with a person.
Absolutely.
And it really is more about having a conversation with someone you can trust that can help you learn those skills for coping.
Yep, it's all about relearning coping skills, because most of us don't have that great of coping skills.
We need to start teaching that at a younger age, right?
Yes, absolutely.
Are you aware of resources in our area here for people who may have a concern about depression and want to check into that?
Well,
or how do they get to a therapist? How do they make that connection?
There's multiple facilities in our area. There's Range Mental Health that has great therapy. There's Grand Rapids has options. I think Northland Counseling it's called. And there's for medication management, there's also Range Mental Health and Northland Counseling. And just primary care can also start that. And then oftentimes they might need a referral though from their primary care provider to get into a facility a little quicker, because we're kind of limited around here for all of the resources that we have. There's not a lot, and we might need a referral to get in quicker. But if people are having any suicidal thoughts, they need to bring themselves in right away to the emergency room or emergency services. That's an ER visit, and a stay in a mental health unit for a while to get stuff figured out. It doesn't often have to be a long stay, and maybe to get a medication started, and that's the best option. It's not good to wait if you're having suicidal thoughts.
So many people will access services, usually starting with their family practitioner, their physician, and having a conversation with them. They will direct them to the right resources.
Yep.
Okay. One of the other things that I think about when you talk about depression, and it probably isn't true depression, but the seasonal disorder stuff that you hear about. What's that all about?
Seasonal affective disorder is almost like hibernation. It's a circadian rhythm problem. When it gets 10% of people in the northern latitude area have, like Florida, I think there was 1% of people with depression had a seasonal component. In the northern area, it's 10%, so it is a lot higher. The darkness, it's not the coldness, it's the darkness. The darkness makes our pineal gland in our brain secrete more melatonin. Melatonin makes us tired. Melatonin makes us sluggish. We want to sleep often during the day, and sometimes all night long. People get very tired and they want to eat a lot of carbohydrates. Then oftentimes they'll start having the worthless, guilty feelings. But it's a little different than regular depression. It's more of an atypical feature because people gain weight. Major depression, people typically lose weight and sleep less. So there's a little difference, and there's a difference in treatment as well. It's called a lux lamp, L-U-X, and you sit by a lamp for about 15 minutes during the morning time hours, right when you wake up. And when you sit by the lamp, you're supposed to have your eyes open because there is a direct pathway from your eyes to your pineal gland, the optic nerve to your pineal gland, that suppresses melatonin from being secreted. So all day long you're going to have more energy, more motivation, and you're not going to want to sleep as much and eat as much. They're really effective, and a lot of the times that's all people need that have a seasonal component to their depression.
Where do you buy such a thing?
Medical supply store. I've prescribed them, but most insurance companies won't cover them. So Amazon has cheap ones.
Do you have a sense of what they cost? Do you have a guess?
Yeah. I think the cheaper ones that I've seen are about $60. They can range up to $300.
Sure.
The more expensive, it doesn't mean they're better. It just means you can sit farther away from them.
Okay.
So, and there's no harm to your eyes. They're UV protected. So we have UV protection from them. So they are safe.
Makes me think of another question when you talk, excuse me, about insurance. For depression, when you get referred to a licensed psychologist or a range mental health, do you know, are those typically covered by health insurance?
They are typically, from what I'm aware of. I don't think there's any insurances that aren't going to cover it, but we do have a Project Care in the area, and a couple people, myself included, we see people for depression, and then there's another woman also at Project Care that sees people for therapy. So people that, if their insurance doesn't cover mental health care, or if they don't have insurance, we will see them at Project Care.
I know there's been a lot of work done in the political arena with the Mental Health Parity Act, which basically, as I understand it, says that if you have insurance that covers medical needs, they now must make it equal coverage for your mental health needs. So hopefully that will be an additional assistance to people seeking care.
It's very important, because if you're not taking care of your mental health, your medical problems are going to fail as well.
They're related, aren't they?
Very much.
So what, in your opinion, what should someone do today if they think they have depression? What should they do?
I would talk to your primary care provider about your symptoms. Ask them what they recommend. If they want to refer you and don't think you need to start a medication right away, they could give you a referral to a local psychiatric clinic or therapy. Or also you could just call the psychiatric clinic yourself and try to get an appointment with the facility.
If somebody looks in the yellow pages and they say, that's what I want to do, what should they look for? Is it listed under physicians? Is it listed under psychologists?
I think it's probably listed under mental health.
Okay.
I think, but I'm not quite sure on that.
What else have we not covered today that you'd like to tell people? One of the things I think of is, I think the underlying message here is that people shouldn't be ashamed if they feel that they are having depression, and they don't have to be alone in that.
A lot of people that have depression already feel like they're a burden, and I think that's the hardest thing. They don't want to burden more people. They feel like they're a burden already, and they're not. That's why we're here, to help people, and we enjoy doing it. And I enjoy seeing people get better. That's why I like my job so much. And those people nobody's a burden. And when it comes to the healthcare system, you're not a burden. You need the help, and you need to seek the right people to get it. And I'm hoping that going to primary care or finding psychiatric help through the clinic will get you headed in the right direction.